60-year-old male presents for a second opinion 1 day before his scheduled cortisone injection for sciatica. The pain's been there for roughly about 18 months. Initially started just down the right leg and has now started to go down the left leg as well. It goes all the way down both calves as far as the big toe, and also he's getting some pain on the front of the thigh as well. The man describes that he's unable to walk more than about 10 meters without having to stop, and the pain is roughly an 8 out of 10, so quite severe. Up to that time, the patient had consulted his GP and a physiotherapist. As stated, the patient is a 60-year-old male who has done a lot of labouring type work over the years and who's generally been in good health. He's also a heavy smoker. So let's go through his timeline so that we understand what's happened until the day that he actually came to the office. So the patient initially consulted his GP in July 2022 with low back pain radiating down the right leg, and so his GP ordered a CT scan. When we look at the CT scan, his back was in remarkable shape. For a man who's done a lot of manual work, the report tells us there is very minimal arthritis and certainly nothing to justify the symptoms that he's been experiencing. The patient returned in September 2022, and this time his GP ordered an X-ray of the right hip and also an ultrasound of the muscles of the hip and groin, looking again for possible nerve impingement or potential tendinitis or other things that could mimic sciatica. And again, looking at the report, this came back completely clear. There was no obvious cause of the sciatica. 6 months following the initial consultation, the patient returned, so this is now in January 2023, and still with sciatica down the right leg that had started to develop down the left leg. This time the doctor ordered an MRI, which is the gold standard for evaluating nerve retention. And in this case, again, there was very little arthritis, no obvious disc bulges to explain the patient's symptoms at this stage. So this brings us to March 2023, which is when I first saw the patient. He had returned to the GP, the sciatica and the back pain was getting worse. It was now progressing down both legs, all the way down his calves, down to his big toe. Because of the MRI report suggesting that there was a tiny disc bulge at L4-5, the GP referred him out for a nerve root sleeve injection, which is cortisone, to the L5 nerve. And so this is when the patient actually consulted us in March 2023 upon recommendation from a friend of his to have a second opinion. It became quite obvious after examining the CT scan and the MRI that this patient was not actually suffering from sciatica. Let's have a look at the patient's CT scan performed in July 2023. The view on the left is a lateral view, a side view of the man's lower back, and the one on the right is a cross-sectional view through each one of these. The line here identifies which slice you are looking at exactly. So the first impressions when we look at the man's lumbar spine is actually very, very good. You can see we've got a nice healthy space here between the L5 and the sacrum, representing the L5 disc, but all of the vertebrae look really quite nice and healthy. When we take a side view of this same area, the gap through, so this is actually the facet joint at L4-5, the gap through here represents the cartilage, and there is not a lot of large bony spurs to represent arthritic changes. If we go down to L5, so if you follow the line, this will tell you where we are. Here we can see the joints between L5 and S1, and again we have a nice healthy gap, not a lot of bony spurring to represent degeneration at all. On the CT scan, we can identify here the spinal cord. We can identify these little circles here that are actually the nerves exiting the spinal cord to form the sciatic nerve. Now, it can be quite difficult to differentiate between the outline of the disc and the spinal cord. Here we have ligamentum flavum that can also become thickened and cause pressure on the spinal cord. And then from there, we have the nerves that exit to form again part of the sciatic nerve, and there's the nerve root. Again, not that easy to identify on the CT scan, which is why in January 2023 the patient was referred out for an MRI, and let's have a look at that now. Now this is a lateral view of the MRI, and straight away you can identify the spinal cord and the nerves that are finishing off that form that sciatic nerve. We can identify the health of the disc a lot better. As I scan to the outside, we can identify the nerves that are exiting the IVF, and there's the disc. You can see plenty of room around this nerve. This is the L4-5 disc that we suspected was impinging the nerve, but there is no sign of that. And the L5-S1 right there. Now let's take an actual view through this same area. Let's have a look. All right. So this is the left-hand side, this is the right-hand side. So as I come out to the right, you can see the line flickering out to the right. I know that I'm actually looking at the nerves on the right side of the body. There they are, and they all look very good. If I go the other way, then now you can see the lines going to the left. I can actually identify each one of those nerve roots. And there is the nerve root right there as I scan in and out. In cross section on both sides, you can see actually just traveling quite well past the tiny disc bulge right there, which we thought was actually causing the sciatica. In this case, there's the nerve root coming off the spinal cord, the filum terminale, and there it is exiting quite nicely without any impingement. So it's quite obvious from the MRI that there is no significant nerve root compression. Let's go back to the initial CT scan, because this has not been mentioned in the report and is actually one of the first things that stood out to me. So again, comparing the MRI on the right and in this case the CT on the left. The first thing that stood out is actually all of this white matter here, all of this calcification that belongs, you can see the outline of the vessel, but this is the actual descending aorta that comes off the heart. This is the major blood vessel that comes off the heart, travels down just in front of the spinal cord, as you can see, bifurcates or splits into two to supply blood supply to the legs. And this is the big red flag that we've been looking for as the cause of the patient's symptoms. All of this calcification represents significant atherosclerosis, and in this case, almost complete occlusion of the blood vessels as they travel down into the legs, reducing the patient's symptoms. So what was happening is that as the patient started to walk, the muscles required more blood, and because of the occlusion, this was not forthcoming, and this is why the patient had what we call a vascular claudication. So as a result of seeing these changes on the CT scan, combined with the patient's history and his physical findings, I referred him out to his GP for a Doppler ultrasound, where they basically measure the amount of blood flow that comes through the aorta and at different arteries as they travel down the leg. Now, the way that we confirmed that was simply to put my hands on his legs, and you could actually feel that the skin and the muscles felt quite cold. And he did report upon questioning that his legs did feel cold and his toes felt cold as well. So then you can feel for the pulse down at the level of the ankle. And again, there was no pulse that we could identify. The posterior tibial pulse was just not there. My advice at the time was to cancel the cortisone injection, as there were no indication that this was the cause. The cause of his leg pain became quite obvious, as there was basically no flow going to both the iliac arteries and basically a trickle flow into the ankles at best. The patient was referred to a surgeon for bypass surgery to his legs, and this in fact did resolve all of his symptoms down his legs. So this was an interesting case. It wasn't the obvious type of sciatica, but it's one that I thought I would share with you. If you enjoyed this, then subscribe to the channel, and we'll try and give you a few more interesting cases.